Good afternoon, everyone, and welcome to IPHA's Fed Talk, Pandemic Nursing, Burnout, and Self-Care. And we'd like to go ahead and introduce our speakers today. We have Linda Roberts, Cathy Coverston Anderson, and Julie Marynus. I'll now turn it over to our presenters.
Great. Thank you very much, Rachel. Hi, my name is Cathy Coverston Anderson. I'm with McClean County Health Department. I'm currently the assistant administrator there and the current nursing section chair for Illinois Public Health Association. So welcome to the webinar today. This is actually an encore presentation from a presentation we gave back in December, and other people wanted to hear about it, so we are offering it again. Next slide. So this is, you can, if you need some more nursing CEs, you can get those through this education presentation. You'll get 1 credit from the American Nurses Credentialing Center, which is through the Illinois Nurses Foundation, but you must complete the evaluation. And it should be noted that if you did not register for this webinar, if you're watching in a group, then you should actually put your email in the chat box so that your evaluation link and your CE can be sent to you. So please take a moment to do that at some point in the presentation, so we've got that, have that for everybody. Next slide. So for the Cs, we're hoping that by the end of this webinar, 100% of participants will self-report knowledge on how to identify pandemic nursing burnout, what to do about it, to prevent it or mitigate it, and we hope that you will have increased understanding on the importance of self-care. All our planners and the faculty have declared no conflict of interest for this presentation, and it is being jointly provided by IPHA and the Illinois Nurses Foundation. Next slide. Rachel gave you a brief list of the panelists today. I'm Cathy again. I'll be joined later by Julia Marynus, and she is with Stephenson County Health Department and currently is our Secretary of Illinois Public Health Nurse Administrators, IPHNA. And then Linda Roberts will join us at the end there to talk about self-care and nurse well-being. And she is with the Illinois Nursing Workforce Center through IDFPR. Next slide. Okay, our agenda for today. First of all, I'm going to be presenting on summarizing some of the survey findings from the 2021 CDC survey of public health workers. Follow that with a brief review of burnout, and then go into the survey results that we did of IPHA nursing section members and Illinois Public Health Nurse Administrator members. So we did our own nurses from Illinois and gave some of the same questions that were done in the CDC along with some others. And we wanted to present those findings to you today. And then we'll be, at the end, we'll go over some nurse well-being and some options for self-care. Next one. All right, so first I'm going to review those findings from the 2021 Centers for Disease Control and Prevention survey. And some of you might have noticed that another survey came out in March of this year, and it is a follow-up. It's from the one last year. It was only posted for a week, so some of you may have missed it, but you'll learn more about that as we go on here. The purpose of this survey was to understand and address the mental health impacts and the support needs of frontline public health workers. So it was not just nurses, it was public health workers in general. And more than 90% of the respondents to the CDC survey were working directly on the COVID-19 response, with most working 41 hours per week or more since March of 2020. Next slide. I have this slide up here just to let you know that we have this study from the CDC when they published the survey result, there are actually 3 documents out there. And the first was an early release in the Morbidity and Mortality Weekly Report, the MMWR, that came out in June of 2021. And it was then, a final version was published later in July, followed in December of 2021 with a corrected version. So if you want to read this article on your own, I would encourage you to go to the December 3rd, 2021 corrected article. And you'll know it's that way. You can see that there is in red that says this report has been corrected and republished. And you can get to the correct report there. Next slide. Okay, so the purpose again was to evaluate the mental health conditions of public health workers, and they were specifically looking at depression, anxiety, PTSD, and suicidal ideation for that. They performed the survey from late March until mid-April of 2021. So for many of you, if you recall, we were in the middle of mass vaccination clinics and as well as contact tracing and case investigation and all that back then. And they got well over 26,000 respondents. It was an excellent response rate. And the sample size, respondents worked in state, tribal, local, or territorial public health agencies or departments in 2020, 2021. And they used our membership associations in the National Public Health associations to find people to take the survey. So the associations that actually participated and distributed the survey to their members was the Association of Public Health Laboratories, the Association of State and Territorial Health Officials, the Council of State and Territorial Epidemiologists, and the National Association of County and City Health Officials. So many of you may actually have had access to that survey link at some point in time. It was a convenient sample, it was anonymous, and it was online. And the mental health symptoms that were evaluated, they used 3 screening instruments, and some of you may be very familiar with these. One was the 9-item patient health questionnaire, the PHQ-9. The second was the 2-item general anxiety disorder, or GAD-2 for anxiety. And then the third was the 6-item impact of events scale, the IES-6, which evaluated for post-traumatic stress disorder. Next slide. So some of the key results for that survey was that well over half of the group reported at least one mental health condition in the 2 weeks before they took the survey. And you can see it was pretty evenly divided there between depression, anxiety, and PTSD, and even 8% who had some suicidal ideation in those 2 weeks before the survey. Another study that was done and published in the MMWR had looked at mental health conditions in the general population, and they found it close to 41%. So among these public health workers, again, it was not just nurses, but public health workers in general, almost 53% reported at least one mental health condition, and that was above what was seen in the general population. Next slide. Some other results were that they were finding mental health conditions were more, there was a higher prevalence in people age 29 and younger, and those who were identifying as transgender or non-binary. And in addition, there were workers who were unable to take time off from work, and they were far more likely to show adverse mental health symptoms. They were nearly twice as likely to report symptoms, and 20% reported that of those who were unable to take time off from work, 20% reported that their employer did not allow them to take time off. And in this study, this factor had the largest impact on reporting symptoms of mental health concerns. But in addition, working more than a 41-hour week, and all the symptoms seem to increase as the percentage of time dedicated to COVID increased, and if you were unable to take time off from work. And some of the reasons that were given for being unable to take time off from work included concern about falling behind in your work, or there was no one to cover your work, feeling guilty, or not allowed to take time off. So, so again, with that increase, unable to take time off from work and working more hours, clearly more at risk for adverse mental health symptoms. Next slide. So some of the conclusions that came from this 2021 survey were that, first of all, that agencies should address work practices that may contribute to stress and trauma, and having and allowing for flexible schedules may help, or encouraging or requiring those breaks and time off, and if possible, to hire surge personnel could assist with addressing those work practices. I know some of you who are, when you've had to do clinics or are pushed to get through a shift, that it's hard to say no or say no to an extra duty, or say yes to, I really do need to take a break. Sometimes managers need to enforce those breaks to get in, to help staff move away from their work environment to take a break and get refreshed a bit. Another finding was that they needed to, they really felt that strengthening work systems, not just work practices, but work systems, to encourage behavior changes so that you can promote mental health. And first among our staff, building awareness of mental health symptoms and helping our staff to identify coping strategies would be a step forward as well. Another finding actually with the in the survey was that approximately 25% of the survey respondents didn't know that they had, or didn't know if they had, an employee assistance program. So one of the conclusions was that employers need to be able to adjust EAPs to be more accessible and acceptable to workers. But first of all, you have to make sure that they even know that they exist, and that shouldn't be overlooked. And then lastly, that to build a culture of workplace wellness is clearly very, very important, and that's not a one-time thing. That's through activities and opportunities that happen throughout the year. Next slide. Okay, just for a quick review now of burnout. Next slide. Here's one definition of burnout for you. I think we're all pretty familiar with this, but it is a stress that can also create a sense of alienation from your work and from relationships. So it is something that needs to be addressed. And the CDC report noted that increases in adverse mental health symptoms among workers have been linked in previous studies to increased absenteeism, high turnover, lower productivity, and lower morale, all of which then could influence the effectiveness of our public health organizations during emergencies, as well as just the impact on the individual, of course. Next slide. Kind of listed out risk factors for burnout versus causes, and they appear similar, but risk factors are not necessarily a cause, but there are many areas of overlap, as you can see below. I wanted to focus a bit on the causes, because I think during COVID, we did feel an actual, for example, lack of control. We had little control over the virus itself, over constantly changing guidance, over the multiple storage and handling that had to be dealt with for the vaccines, over the public's response to COVID. There was just our sense of control was greatly diminished during COVID. Looking at work-life imbalances and lack of social supports, we all had more work hours, less time with family and friends, which can definitely impact your ability to have social supports. And even the social distancing that was in place throughout COVID may have contributed to additional feeling a lack of social support. Extremes of activity are a known cause for burnout. And I had just seen with the CDC survey that you've got over 50% were working extra hours and unable to take time off, which contributes to burnout. And then if you had dysfunctional workplace dynamics before COVID, they may possibly have been exacerbated during COVID, the COVID response. And given the extra duties, the many different functionalities that various workplaces had to deal with because of the COVID response, we all may have had other duties as assigned, and that can lead to unclear job expectations as well. So, and just as a reminder, under risk factors, you'll see there helping professions. I would bet that most of our participants on this call are in the helping professions, and that does place you at risk for burnout just by being in the helping professions. So, next slide. So consequences, I think we're all pretty familiar with that. They're both short-term and long-term consequences, and we've seen more in terms of those long terms as there's been more studies on burnout, and we know the impact that can have even on chronic disease and exacerbation of your chronic disease, heart disease, hypertension, and what's cut off there is type 2 diabetes at the end. The photo, by the way, is from the 1918 pandemic, flu pandemic. So, next slide. Okay, so let's move into the survey results that we did last fall. And just for those of you who are unfamiliar with those sections, IPHA has many different sections. If you're not a current IPHA, Illinois Public Health Association member, there is a nursing section, but there's many others. For this survey, it was just the nursing section members that had the availability to the survey. And then also the Illinois Public Health Nurse Administrators, which are all members of a local health department, or they're a nurse manager within the local health department. And IPHNA is separate from IPHA, but it's been designated as an official partner with a seat on the executive council of IPHA. So that's why those two groups were chosen. Next slide. Let's see. So first of all, in preparation for this webinar, and as a companion piece, the CDC survey that we just went over, we wanted to survey our nursing members, and IPHA does have nurses scattered throughout its many sections, but we did, again, focused on those two sections because we wanted to see the impact of COVID response efforts, its effect on the mental health of our membership. And we're looking at basically all of 2020 and 2021 from January through basically October. The survey that we sent out was sent out in mid to late November of 2021, and respondents had until the first part of December to finish it up and turn it in. It was a convenient sample again, because it was just two different entities that members were sent the survey to. It was anonymous. We did it through SurveyMonkey, and we had about, from the nursing section, we found that some were undeliverable, but we had about 160 people on that list. IPHNA had about 75. We did see some membership overlaps. So if you take out those overlaps, we had about 223 people who we think received the survey. And from that had 85 people responding, which was a 38% response rate, which we thought was very good. And particularly given it was during everybody being very busy with COVID, it was, we were very, very pleased with that response rate. Next slide. So very quickly, just in our who took our survey, 98% were nurses, of the 80, 85, 83 were, and most were, some were BSNs, about 45%. And we had most, though, were frontline nurses or nurse managers in that. Some of this slide is cut off, so you can, from underneath there, I can tell you is some of our other respondents were from long-term care, hospitals or outpatient facilities. Some were non-governmental organizations, and we had 7 people who were retired. And some of those retired respondents said that they were, many were working as a volunteer or working during the COVID response. So, and there was 3 that were from an FQHC. Next slide. Most were from local health department, but there you can see that there was more where the other survey respondents came from. Next slide. Unlike the CDC study, we had very few people responding who were in the 29 and under age group. Most were in the 50 to 69-year-olds, and the rest, 30 to 49-year-olds, were also had a strong response there. So there were 47 in the 50 to 69-year-olds and 33 in the 30 to 49-year-olds. Next slide. Okay, some little explanation here. The next series of slides compares responses to 4 questions that were asked for the 2 different time periods. So same question, but it was asked in thinking about your work in 2020 versus your work in 2021. So, so the same question was asked, but the respondent had the opportunity to answer twice, once with 2020 in mind and once with 2021 in mind. So this question, estimate the percentage of your time devoted to the COVID response activities during an average workday. And for those whose work with COVID response activities was 50% or less of their workday, you can see there was little change from 20 to 2021. However, for those who you see a much bigger change between 2020 and 21 when you look at that 51% to 75% of your time was devoted to COVID. There was that big jump from 9% in 2020 to 24% in 2021. The survey did not ask or ask people to account for why there might be a difference, what changed for them. So that's unanswered in this thing. And just if you look at the stats a little differently, basically, and looking at the 76% to 100% of your time being devoted to COVID response activities, over that 22-month period, 40 to 51% of survey respondents worked 76 to 100% of their time with COVID duties in the 22 months that was being looked at. Next slide. Now, some of you may recognize part of this question as it comes from the PHQ-9. However, the PHQ-9 asks the question and then says, did you feel this in the previous 2 weeks? We were asking people to look for it for a whole year in 2020 or for those 10 to 11 months in 2021. So how often did you experience feeling down, depressed, or hopeless? And you can see that between the 2 years, there was almost no change in any of the categories. It was very, very small response change. And if you take a look at the percentages given for the response for feeling down, depressed, or hopeless more than half the days, it's daunting to consider the impact that can have after experiencing that over 22 months. Next slide. This question was how many days per week on average would you take work home? Or if you were working remotely or would you do that work on projects after hours and after your organization had officially closed for the day? So we know that's different, and what a work day is for each of us is a little different. Some of us are 7.5 hours or 8 hours. It could be 12-hour days or 10-hour days. We didn't ask that. We just said for you and the number of hours per week, what did you experience? And with this, there was not much change from 2021 if you were taking work home 2 days or less. Where we found some of the big changes were in those 3 to 7 days per week. Because if you look at the percentages for those bringing work home at least 3 days per week up to 7 days per week, it totals actually 51% in 2020 and 50% in 2021. Again, and that, for those of you if you're looking, I'm adding up the percentages in the last 3 categories per year. And so there was very little change. It just shuffled a bit between how many days you were actually bringing work home. But in general, good half of our public health, our nurses were working and bringing work home between 3 and 7 days per week over those 2 years. Next slide. Here's the last comparison slide for those 20 comparison slides between 20 and 21. The question asked, how many more hours per week did you work on average above your required number of hours? And while there was a reduction in 2021 compared to 2020 in the hours worked each week for those putting in 5 to 16 hours extra. If you there was some change, but if you total up the percentages for the 3 categories that include anywhere from 5 to 16 more hours per week, the majority of respondents, which was 73% in 2020 and 63% in 2021, actually ended up putting in 1 to 2 extra days per week in their COVID-related activities, or trying to catch up with their other work and having to work more hours. Next slide. Okay, this question, how often have you been able to schedule and take time off from work? And you see there that a good portion of the respondents were sometimes able to take some time off. That there were unfortunately some who never were able to take time off from work. And if you go to the next slide, that shows the percentages there. And what I wish we had been able to ask, that if you look at the always were able to take time off from work, there were 15 respondents who were always able to do that. I would love to have asked, how did that happen? Were there policies in place? Did you have supportive management? Were people kind of looking out for you and kind of making you take time off if you hadn't taken time off for a while? It would have been lovely to know what made that possible for people. Next slide. So for the people who were unable to take time off from work when you needed to, what was the reason? And I'm going to have you can see there that there was no backup or too much work that needed to be worked on, and just feelings of guilt were the reasons given for being unable to take time off from work. But I will move to the next slide, Rachel, so that they can see what those actual choices were. And one of the ones that were concerning was at the top one, when there was an organizational policy in place that limited time off during a public health emergency. That is something that could be looked at in the future, because that was something that was hindering people's time off. And sometimes, yes, that it does have to happen, but it is an area where we could maybe take a look at, can that be changed and modified in some way? Or no backup to cover your position. Is there a way to find and have some more, do some more training ahead of time for the next pandemic, so that there's some more depth in your area. And both the too much needing to be done before, during, or after your hope for time off. I think sometimes that happens even when we're not in a pandemic. And the feelings of guilt, and how do we address that as employers and as coworkers to that. Next slide. Okay, during your job duties, have you experienced any of the following? And this again, I want to show you just on the slide. The top 5 are more negative experiences. The bottom 4 are more positive experiences that you may have had during the pandemic response. So you can see that for the negative responses, emotional exhaustion, feeling a little bit of cynicism, and feeling overwhelmed were really the top 3 of the 5 possible responses. And just to note that the light blue, which is feelings of alienation from coworkers and your work duties, that is one of the key red flags for burnout in addition. And the top on the green is feeling negative about assigned job tasks. Looking at the positive down at the bottom 4, that's a sense of accomplishment in a job well done, and gratitude for the teamwork and for your teammates was the pink bar there, and appreciation for the hard work performed by others. And the last one there is hope for and belief in a post-pandemic future. And unfortunately, hopes scored the lowest in those groups, but that there was gratitude for teamwork and appreciation for the hard work. Next slide. Oh, next slide after that. All right, so the respondents were asked today, would you describe yourself as burned out? And you can see that most said no at the time that they were taking the survey in November of 2021. Next slide. If they said yes, it's how long have you been doing that? And most said it within the last 1 to 4 months before the survey was taken. If you look at the bottom in the purple, the 22 months or more, that would be people who were actually experiencing some burnout at the very beginning of the pandemic, even before going 22 months into it. So that's something to be noted. Next slide. And next, because that's just the percentages of those. And if you said no, that you weren't currently experiencing burnout at the time that you took the survey, did you experience burnout anytime between January 2020 and October of 21? And definitely 62% said that yes, they had. Next slide. We had heard of this term rust out that some people were using instead of burnout. So we thought we'd throw that in there to see if people thought that better explained their current state of being. And about 61% said yes, that did. Next slide. Okay, time to introduce Julia. She again was from Stephenson County Health Department, and she is the current secretary for Illinois Public Health Nurse Administration, administrator, excuse me. And she'll be addressing the survey results that talked about self-care, as well as the narrative responses that we allowed for. So let's see.
Thank you, Cathy. Good afternoon, everyone. So question 22 is looking at what has helped to relieve any burnout or rust out symptoms. And so as we analyze and take a look at a lot of that, the most respondents valued family time or vacation time. And also then more of leaning toward what's a normal lifestyle, some healthy sleep, some healthy food, some time to reflect spiritually or attend church or practice gratitude. Also, what came into play was being able to set boundaries or limits. And I think, as we've seen through some of the answers to other questions, at times people felt they had the power to do that, and other times they felt powerless to do that. Out of those 83 respondents, there were two people that felt like there was no coping skill or nothing they tried really helped relieve those symptoms. And then there was a very small number, 4 also, that felt like they did not feel affected by any of the changes. We'll go ahead and go to the next slide. And this is just breaking out and looking at the information I just sort of pulled together there for you. A lot of people also sought counseling, and felt like if they had time for leisure activities or doing hobbies or reading, that those kind of things help relieve that rust out symptom as well, symptomology. Next slide, please. Okay, so this is question 23, and it says, do you think that the profession has changed nursing at all? And it's a pretty much overwhelming yes, that there was a feeling that this whole COVID episode has changed nursing in general. And I'm going to ask you to flip to the next slide. And that again shows the number of respondents, that the greatest number felt that there was a change. And next slide. And this talks about the responses that came through on that. And we had at least 60 comments and responses about nursing changing. And very similar to some of the other questions that Cathy has gone through on the survey, there's been a positive experience and a negative experience. So some of the things that were positively experienced was there was an increase in value and respect and pay and recognition for what nurses did, especially public health. There's also increased job opportunities and remote work opportunities that we may not have had before. But then at the same time, there was increased stress, increased burnout, a real very real fear of the disease process itself and how it affected our own families. And then as time went on through this pandemic, nurses did run into families and people that they contacted, and they were verbally and physically abused with regard to trying to assist families and being quarantined and following the rules and things like that. It got to the point where some nurses experienced that, and they would call families and the reception was very negative as the pandemic went on. And I think that just speaks to the nature of the whole dynamic of the pandemic, is the ongoing nature of it, and then the changes that would occur as we may have moved into a summer period and felt like things could be loosened a little bit and families started getting together again, and then you moved into the fall and more barriers and things were put back in place again. So it is evidently a strain on our whole nation. Evidence-based practice, profession negated by politics and polarizing social events. That was all part of the journey as well. We all saw and lived through that as well. And so, it begs the question, is there a line between evidence-based practice and whether politics or social media should be able to sway what is evidence-based practice? Next screen, please. Question 25 is, how can we better prepare nurses for the next pandemic? And we did receive more than 50 comments for that as well. A lot of that went toward increasing self-care knowledge, maybe time for mindfulness, access also to programs such as the AEP that Cathy had mentioned earlier, you know, and I'm not aware, you know, it would be nice to look at how many health departments actually have that as an option. I know that our county did not have that as an option, but some members of our nursing team were able to be covered by their spouse's insurance, and their spouse's insurance had that available for them to use. So they were able to take advantage of that. Offering counseling services, some respite, stress management for the staff, just any time off, anything that could help give everybody a chance to just catch their breath. Also, the policies in place need to change so that we can decrease the red tape and move the politics out of evidence-based practice health and the effects that they have on it. And just to very quickly comment on recent events here this week, where they've said that the CDC doesn't have the power to discuss with our nation or have any kind of power with enforcing when you should use a mask or when you should do anything like that. It's the same kind of tenuous power that public health has in each of our communities to quarantine or not quarantine, to mandate use of a mask or not mandate use of a mask. It's been really all over the map with that. And so it's been a long time since our nation has experienced something where we've had to put those kind of public health services in practice. And I think so unfamiliar for many of our population that it seemed like an invasion on their own privacy and their own choice. Next slide, please. And I'm going to be handing off now to Linda Roberts. Linda, are you available? It looks like Linda is trying to log back in. Here she is,
Okay,
Linda.
can you hear me?
We can,
No,
and we can see you now, Linda, too. Thank you.
Thank you. I thought my big problem was going to be keeping the dog out of participating, but my internet seems to be variable right now. So hopefully we can get started. I'm Linda Roberts. I am a registered nurse, and I have been a nurse for about 40 years, and I'm the manager of the Nursing Workforce Center. I thank you for this opportunity. I'm going to be presenting about nurse well-being and options for self-care. Okay, next slide. My ask was to present information on resources for self-care that are available to individuals for free. Okay, I think the next slide, this just shows agenda. Let me turn on, but that's all right. I'll just keep talking.
Rachel,
that's
a separate
stopwatch. So
yeah. Rachel, it's a separate presentation that you should have that you can get up there.
I don't think I have a copy of it.
Well, I will send it. I thought I had sent it in advance, but I can send it along afterwards. So now you'll just have to listen to me talking for a bit, and you won't get my wonderful slides that I worked so hard on. That's on our agency slide background. Anyway, my ask was to present information on resources for self-care that are available to individuals for free. The slide has, the slide has objectives for my portion of this presentation. I'm going to focus on two things: the American Nurses Association, the ANA website, nursingworld.org options, the resources that are available, and Pro Quality of Life, proqol.org, a pocket card, and a bit about that website and those resources. I'm not going to discuss the suggestions for workplaces, the support systems available to employees, only talking about what individuals are available to resources. First, I'd like to talk a little bit about the Illinois Nursing Workforce Center. The background of the Nursing Workforce Center: it was established in 2007 through legislation, and it's Article 75 in the Nurse Practice Act. The Workforce Center is located in IDFPR, the Illinois Department of Financial and Professional Regulation. It is the only health policy board and a regulatory agency. It's based on the North Carolina model, located in the Division of Professional Regulation, to promote a partnership with the Board of Nursing. The mission is to advocate and ensure for the appropriate nursing resources necessary to meet the healthcare needs of the citizens of Illinois. All IDFPR boards are advisory. The nursing board meets 6 times a year. There are vacancies on the board if anyone's interested. We currently have remote meetings. When we do meet in person, it's by video conference through IDFPR offices in Springfield and Chicago. I'm going to pause for a moment in my presentation. And we talked about having a partnership with the Board of Nursing. The answer to the question, when will license renewal for RNs, APRNs, and FPA APRNs begin? My answer is, I'm not necessarily certain, but what I do know is the renewal deadline has been extended from May 31st to August 31st, 2022. That's 3 months. That means you have 3 more months to complete and obtain all of your CE. The second part is nurses who renew their RN, APRN, and FPA APRN license prior to the deadline of August 31st, 2022 expiration date will have their renewal fee waived. During renewal, we will still go through the process of answering the mandatory questions. Are you a registered sex offender? Have you been convicted of a violent felony? Did you acquire the 20 hours of CE? Those sorts of things, but there will be no payment of fee. IDFPR is currently moving to a new technology platform that should make the renewal process easier, but has resulted in additional time being required to open online license renewals. When the renewal portal is open, you will receive an email. So please make sure that your email address is up to date. Ooh, this is my current slide for where my notes are. This is exciting. The Nursing Workforce Center website, nursing.illinois.gov, it's the easiest access to the IDFPR nurses page, the page to go to for when you renew your license. When you go to nursing.illinois.gov, there's a tab on the left that says license/renewal. Click on that. That'll take you to the IDFPR nurses page. It's a white page that says nurses at the top. And when the renewal is open, there's a little icon on the left that turns green and it dances around. Right now, it's only green if you're an APRN CE provider. There's a renewal icon. On the Nursing Workforce Center, there's also a tab for continuing education. There's a fact sheet, a resource document for the questions that are usually asked regarding continuing education requirements that one needs prior to license renewal. It includes information about the sexual harassment prevention CE, the fact that the next time we renew, there will be 2 other CEs that will be required of the 20 hours. Also on the page, there are lists and links to all Board of Nursing approved pre-licensure nursing education programs. There's links and names of all baccalaureate completion programs physically located in Illinois. 90% of those courses are available online. There's also lists and links to all graduate nursing education programs located in Illinois. In addition, there are data and reports, all the data that's been voluntarily collected with RN, LPN, and APRN post-license renewal reports since 2014 to present, and a few old reports. Okay, how about next slide, please? Focusing on well-being and options for self-care. Most of this slide's information has been covered by both Cathy and Julia. One thing I do mention is that I try to avoid the term resilience. It can be interpreted to mean an individual is at fault for burnout and the secondary trauma of compassion fatigue. The discussion will be on individual well-being, not on team-based model of care that focuses on workforce resilience. Next page. The concept of post-traumatic growth was new to me, at least the specific parts of growth. And Dr. Tim Cunningham has a part in developing and maintaining the ANA's well-being website, which is useful and it's available 24/7. The concept of post-traumatic growth, how do we navigate stress and suffering? Post-traumatic growth encourages us to reflect on, authentically acknowledge, and meaningfully elevate 5 domains of growth occurring during and after trauma. The domains are spiritual growth, deeper relationships, appreciation for life, conceive and experience new possibilities, and an increase in individual strengths. Next slide. Started working on supportive nursing in 2017.
Linda, I think your internet
to
is
the ANA web.
cutting out.
Okay.
Let me turn your video off. That might help with your bandwidth.
Okay.
Okay, go ahead and try again, Linda.
How about this?
Okay, that's better.
Oh, Lord. Modern mechanics. Kind of worse than when I first started working in the ICU. One of the when I was certified, you had to know how to take apart and put the ventilators back together again. But we're not quite there yet. The wellness tools and resources on the ANA website. The key ingredient to the ANA website is that there are multiple options to choose from. The options regarding communication and reception of information and resources, and it's free. The wellness initiative have also been shared through state nurses associations such as ANA Illinois. For example, last fall, ANA Illinois offered 12 weeks of phone text with reminders of self-care activities. Next slide. The resources, some examples of the resources: Mood Fit, a guide to foster sleeping better and restoring energy. Happy app, there's a 24-hour call line. There are different podcasts available, including topics such as nursing state of mind, impulse control, get the rest you need, support your peers. You can also request to receive emails to stay updated on things such as COVID fact sheets, vaccines, variances, a vaccine webinar, ethical challenges, moral dilemma, ventilator management for non-ICU nurses. More on Healthy Nation on the next slide. Next slide, please. Nursingworld.org. If you're looking for help but not sure where to start, this stresses self-assessment and a nurse's guide to mental health support services. Additional mental health and well-being resources. You can have downloadable and printable resources. Information about arriving home safely, free and discounted resources for nurses on Healthy Nurse, Healthy Nation, nurse suicide prevention and resilience. The goal is to connect and engage nurses, employers, and organizations around improving health in 6 separate areas: mental health, physical activity, nutrition, rest, quality of life, and safety. There's also a section should you wish to get involved in legislative and regulatory advocacy. Next slide. Another option for well-being and self-care is a professional quality of life website. and Pocket Card, which have been available for 15+ years. This has proven to be a valid measure of compassion, satisfaction, and compassion fatigue. It's easy to use, easy to score. It's not a medical test. The site has resources on compassion, satisfaction, compassion fatigue, and professional quality of life. The Pocket Card for COVID-19 crisis is a free resource that has been revised by the creator, Beth Hudnall-Stamm, in March of 2020. It's about caring for yourself in the face of difficult work for the current healthcare crisis. For example, how to become better at switching between work and off work modes. The Pocket Card is not a slide because there was a lot of details. And as a criteria for free use, it must be presented in its entirety. And I thought it was too much for one slide, but let me give you a little bit of information. It's entitled Caring for Yourself in the Face of Difficult Work. Our work can be overwhelming. Our challenge is to maintain our resilience so that we can keep doing the work with care, energy, and compassion. It has 10 things to do in a day, such as get enough to eat, share a private joke, do some light exercise, support a colleague, focus on what you did well. On the back side of the card, it focuses on your empathy. Your empathy for others help you do your job. It's important to take good care of your feelings and thoughts by monitoring how you use them. The most resilient workers are those that know how to turn their feelings to work mode. And there I go. Can you hear me?
We can barely hear you, Linda.
Well, all I was going to say was thank you, and hopefully I provided you with some useful information.
That's great. Thank you, Linda. And I think at this point we can, we've got just a few minutes left. We could open it up for some questions if anybody would like to ask anything. And Rachel, I don't know, can they just unmute? Can we unmute people, or will you unmute them if they want to speak?
They can enter any questions you have into the Q&A or the chat box, and then we can facilitate them that way.
Okay. Okay. Let's see.
So if you have any questions, please go ahead and enter them into the chat box or the Q&A feature.
While we're waiting there, just a reminder too, that if you joined late, and if you please put your email into the chat box so that we, if you haven't registered, if you didn't register for the webinar and are watching in a group, please put your email in the chat box and you will get the evaluation form. And also if you want a CE, it'll be very important to have your email in that chat box too. So, oh good, some more emails coming in. Great. Okay.
Well, thank you everyone for joining us today. We so appreciate it.
We do. I think we'll give 30 more seconds for putting in your email address. And Rachel, I think we'll hang on. The speakers will hang on here for a little bit so we make sure we've got all those emails in, and so we don't miss anybody. But we all do want to thank you for joining us today, and we will check into whether or not this webinar will be archived at IPHA and let you all know in case you want to have other people view it later. So thank you very much, everyone, for attending today. We appreciate it.
Bye.
Bye.
I see they do have a question about the slides being available as well.
You have a question about will the slides be available? And I believe so. We will send that out with an email so that you know if we're able to send out the slides or not. I know the survey results we intend to send to the nursing section members and IPHNA since they were participants. So for sure, that part of the presentation will definitely be available to you. So. Okay, thank you very much.
Thank you.
Mhm.